more than 35 years of age, you have to check your BP regularly, at least monthly. You have to visit your physician and check your BP. If your blood pressure is more than 140 by 80 mg of mercury, you will be declared as a person of hypertension or high BP. Number one. Number two, if you have got high BP, you have to consult your physician regularly. You have to take medications as per the advice of your physician, and primarily you have to moderate your lifestyle. Lifestyle modification in case of diabetes or in case of high blood pressure is essential, because if you are simple a little bit of obese, you have to reduce your body weight. You have to take your diet as per the calorie mentioned by your physician or your dietitian. You have to do regular physical exercise, regular morning walk or swimming, so that you can keep your BP within the range. You have to take adequate of vegetables. You have to take adequate of fishes, which will lower down your cholesterol and everything. So you have to maintain a good lifestyle along with some medications. You have to look after your lipids also, your urea creatinine also, your fasting PP, glucose, HbA1c also. So you have to consult your physician regularly. Now, as per JNC 8 recommendations, there is no relationship with extra salt taking and high BP. So, if a person has got high cholesterol or triglycerides, it never matters if the person takes lamb or if the person takes mutton. It's a very old conception. There is no direct relationship with taking off extra salt and high blood pressure nowadays. You know that if you are suddenly, if you are a calm and quiet person, suddenly your anger becomes very much rigorous. You are becoming fatigued. You are having that sleeplessness. You are having headaches. You are having dizziness. All these symptoms are associated with high blood pressure. First of all, you have to do lifestyle modification. First of all, in case of high blood pressure, in case of obesity, in case of diabetes mellitus, the first and foremost is lifestyle modification. And primarily, you have to take help of your physician to make a balanced diet, which is recommended for you. Number one, you have to keep your lipids within control level. You have to maintain your blood pressure adequately controlled with the help of medication and lifestyle modification. Yes. If the patient is young patient, if the young patient comes to my chamber with high BP, if I see that it's a isolated systolic hypertension, most of the cases in case of young patients, we see that the patients are having isolated systolic hypertension, that the systolic blood pressure is high and the diastolic is normal. Suppose the systolic blood pressure is 160 and the diastolic is 80 millimeter of mercury. So in these cases, we recommend primarily CCB, calcium channel blockers. In other cases, according to my part, in fact, I prefer telmisartan as a drug of choice, ARB as a drug of choice in control of high BP. If I require that adequately BP is not controlled, I add telmisartan with amlodipine, telmisartan with hydrochlorothiazide or other molecules. ARB has got this telmisartan has got PPR-gamma activity. So you are getting added advantage if you use telmisartan in case of high BP. I usually, if I get a high blood pressure patient, definitely I review every 7 days. I review every 7 days. According to that monitoring, I adjust my dosage and medications. Thank you very much.